Hey guys, wanted to talk about overcoming BPD tonight. So, thank you guys so much for being in the group. And I wanted to talk about the different elements of BPD and what we can do about that, how to overcome them, etc. So, BPD, you guys have heard me talk about before. Got some wild, crazy hairs here. Okay, ignore that. But different origins for BPD. It can be trauma, it can be brain anomalies, brain chemicals, different things like that. And lots of different ways to overcome them. What I generally do with people is first a thorough clinical intake. So we're looking at all the things, looking at family of origin, exploring possible origins for what they're dealing with, and then understanding the self-limiting beliefs that developed as a function of being of having that sort of upbringing and those early experiences. So then once we identify those negative core beliefs that develop when we're knee-high to a grasshopper, if you will, then we work at unpacking those. So what's significant about those origins is that a lot of what happens to us when we're younger is particularly impactful. And that's especially true if it's something that happens before the age of 6. So before the age of 6, we're in a brainwave state known as theta. And that is the brainwave state that we're in when we are hypnotized or meditating. So that means we're highly influenceable, very malleable. So things that happen to us leave an indelible impact. At any age, it's possible, but especially before the age of 6 because of that brainwave state. So we want to look at what happened to you early on in life, whether there's a genetic contribution to the BPD that you're experiencing, or if it's trauma related, or both, or something else. And then we want to take a look at those core beliefs and then help you figure out how to overcome those beliefs. So we're going to look at those limiting beliefs and help you figure out, like, what's a different way to see this? So where did these come from? Let me reprocess what happened, reframe those early experiences, look at things differently, and then compartmentalize the experiences and then move forward with more positive thoughts, or at least neutral thoughts, thoughts that aren't negative. So question, genetics makes you vulnerable to BPD, am I right? Yes, so that's one of the 4 causes of BPD that I've talked about in other videos. The primary cause of BPD that I've seen, I've been treating BPD for over 20 years, the primary cause of it that I have seen is related to trauma, specifically trauma early in life, and specifically sexual trauma. These are not absolutes, but those are the most common things that I see. Someone's asking about BPD and BED. Assuming BED refers to binge eating disorder. If that's not the case, then let me know what you're referring to. But those two conditions can coexist. Eating disorder can coexist and very often coexist, BED, binge eating disorder, very often coexists with BPD. And that's because I think the pervasive nature of BPD. So when you have a personality disorder, it affects, you guys have heard me say it's an information processing disorder. So it affects how you receive, perceive, process incoming information. And when it affects that many areas of your life, and if that lens that you're looking through is very negative or anxious or fearful, then that's going to cause other mental health conditions. Now, when it comes to eating disorders, including BED, any of the eating disorders, the way I see those is they're anxiety disorders. And the antidote for anxiety, you guys have heard me say, is control. So when we think about control, one of the things that we can always control is what goes in and comes out of our bodies. And so a lot of times we will see that BPD coexists with eating disorders, I think, as a manifestation of control. So a male, don't recall being sexually abused or sexually assaulted, then again, could be trauma closing off that memory or those memories. Absolutely, your brain could be blocking that out. At the same time, it doesn't necessarily have to be the case. It's just that's what I've seen most often as the origin of BPD. But it can be genetic, it can be brain anomalies. There's all sorts of different things that can go on that lead to the development of BPD. So no SA, but I was adopted. So adoption in and of itself doesn't necessarily mean a person's going to have BPD, of course. But to your point, it depends on how you process the adoption, how your adoptive parents dealt with that, what experiences you had in that family. And then also there may be genetics that you're fighting. And if you don't know much about your family of origin, or I'm sorry, your genetic family, then there may be stuff that you're not aware of. So, all right, there was a message that I may have missed. So if I missed it, ask again. Sorry, the comments and stuff come up in such a tiny little area that I have a hard time keeping up with them sometimes. So y'all bear with me. Yeah, lots of different origins. You're welcome. Lots of different origins for BPD. As I said, sexual trauma is the most common one that I've seen, but definitely not 100%. I've seen people with have like wonderful childhoods, but they have this genetic predisposition, or there's something that happened to them outside of childhood or outside the family of origin that resulted in this BPD configuration. Are there a lot of people with BPD that were in foster care? You know, I don't have a ton of patients who have been through foster care. I'm not sure why that is. I would say that it's probably, I mean, if I had to guess, I would say it's probably not uncommon, and that's for a couple of reasons. One, just the instability and maybe the emotional neglect and sometimes the abuse that characterizes the foster system, unfortunately. Those are the kinds of things, those early experiences can lead to BPD. So I would suspect that's in there. The other thing is sometimes the children who end up in foster care come from families where there's a lot of tumultuous things going on, or, you know, the parent may have felt unstable emotionally to care for their child. So they may have some genetic contributions that are popping off there that they may or may not be aware of. So if I had to guess, I'd say there's probably a decent amount, but I don't have any specific research around that, just based on kind of how I think about it and what I've noticed. Thank you for following. How can I handle my BPD? So it's really important to understand where it comes from. It's very difficult to change your personal narrative if you don't even understand how it was written in the first place. That's one of the things that I say so often. Oh, you're welcome. So if you understand how you got to where you are, why you respond the way you do, or why you react the way you do, you're going to be more inclined to change it. It's kind of like when you have a toddler and they reach that age, like somewhere between 3 and 5 generally, where you can reason with them, you can sort of negotiate, you can explain things to them, and they become a little bit more reasonable, or at least understand reason when it's presented to them. Plenty of 3 to 5 year olds are completely unreasonable little beings, but it's like that point when you can reason with them and you can explain to them why they can't take their toy to preschool or something like that. Well, when somebody explains to us why we're thinking, feeling, behaving, believing the way that we are, it gives us more control over it. So that's the first thing. The next thing is, if there's any trauma that has contributed to the BPD configuration in your personality, then you want to deal with that. You want to unpack that trauma, and prolonged exposure is the best treatment that we know of for dealing with trauma. My preference with that is EMDR, eye movement desensitization and reprocessing. Not everybody likes that. Not everybody has access to that. Not everybody tolerates it. But anything with prolonged exposure, what that means is that you're replaying the trauma, but you're learning to compartmentalize it and store it differently. You can't forget it, unfortunately. You can't just block that out. But you're learning to store it differently in the brain so it's not so impactful. So trauma is concentrated in 2 deep brain structures, the amygdala and the hippocampus. One is memory, one is emotion. And it's kind of stored like this. And then when we look at EMDR, other desensitization, EMDR specifically, we're bringing that up and we're using bilateral stimulation of the brain to sort of store the information differently. Thank you, Vicki. I'm glad it's helpful. And so trauma work is really important, whatever method it is that you end up using. So understanding your behavior is important, trauma work. And then DBT is my favorite method, just teaching people about emotional regulation, how to tolerate distress, how to figure out what to do with things that they can change, and how to accept the things that they can't change. All the DBT principles. So hopefully that gives you some ideas. Could you explain some ways to stop splitting or come out of it faster? So splitting is, for those of you who aren't familiar, splitting is, an example of splitting is like in a relationship where you see idealization and devaluation. So one minute someone is the greatest thing since pockets on shirts. The next minute you perceive that they're abandoning you, betraying you, letting you down in some way, and you think they're Lucifer in human form. Now that's hyperbole to make a point, but for some people it does feel that extreme. So how do we stop that? Well, there are lots of ways to stop that, and we're talking about this more in the subscription group. But basically, one thing that comes to mind is you want to work at maintaining a balanced perspective of people, of any person you encounter. And that means just recognizing that we're all made up of good and bad characteristics. We all have good and bad traits. We all make good and bad choices. So just recognizing that a person has a number of different characteristics or traits. And then if you feel a certain way in response to something they've done, you want to figure out how to pause, take a breath, and then address the issue. So you want to work on responding versus reacting. And I've done videos on minding the gap. There's a video in the subscription group specifically about strategies for overcoming that and minding the gap so that you can figure out how to respond to them and ask for what you want, get your needs met when your brain is wanting to split them into all good or all bad. So that's just one strategy to kind of help. Again, unpacking a lot of that in the subscription group. So make sure that you are hanging out with us there. Going back, sorry, this is so helpful. Okay. It's so difficult for me to see colors in situations. It takes me so much time to realize things. I'm not sure what you're referring to there, in terms of seeing colors. I don't know if that's just language that I'm not familiar with, or if it's a typo. Or if you're talking about like variations in a situation. It takes me so much time to realize things. So please say more about that so I can respond to your question. Mostly when I'm angry. Yeah, when we're angry, just in general, when people are angry, that's the lens that we're seeing things through. So it adds another layer of processing that's needed, because you have to be able to step outside of that anger so that you can, again, respond versus react. Christmas is coming up and I'm kicking myself because of the people I'm around at that time. You're welcome, Kitty. RY Official, say more about that. If the people that you're around at that time tend to be very negative or pessimistic, cynical, then it's very important that you go in with as much positive thinking, or at least neutral thinking, as you can. You guys may have seen, I just posted a video. I just realized that my team did not take down my Cyber Monday offer, and that is for my Negative Automatic Thoughts course for $1. So I actually just posted about, like, don't be negative Nelly or Debbie Downer at Christmas. Get in, do the work. It's a relatively short course with videos that you can watch at your leisure, at your convenience, and you can sort of change your thinking. And so then, to your question here, you can kind of implement some of those strategies as you're immersed in those kinds of people. So if you're talking about something different than that, certainly comment again. This time of year isn't that stressful, but the people are a headache. Yeah, so it's very important to stay in positive thoughts, or at least neutral thoughts, when you've got other people sort of dragging you down or whatever. So go check out that course. It's at the psychoeducationacademy.com, and then it's /CM for Cyber Monday, and then -NATS, Negative Automatic Thoughts. So psychoeducationacademy.com /CM-NATS. That will help you work on those negative thoughts, and that helps you kind of deal with other people's negativity when they present it to you as well. So hopefully that can help some people. Okay, so I got that. Let's see what's next. My therapist told me that I couldn't have BPD because I have a long-term career. Taylor, I'm so sorry. This, y'all know this is a pet. And if you've been following me for a minute, you know this is a pet peeve of mine. You can't have BPD because blah, 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 blah. No. Like, on what planet does that make sense? Like, I'm sorry. There's so much stigma still associated with BPD and so much freaking ignorance around it. It drives me insane. So I don't know whether you have BPD or not, Taylor, right? I've not evaluated you. But let me just say, plenty of people with BPD have long-term careers. They have successful relationships. They have healthy, well-adapted children. Like, these things are possible. BPD doesn't have to affect every single area of your life. And a lot of people, they will struggle like in relationships, but then when it comes to work, they are like rock stars. I've been treating BPD for over 20 years. I've got people in all sorts of careers. Some of them are successful mental health practitioners, doctors, attorneys, CEOs, stay-at-home moms, you name it. Whatever job or employment or career you can think of, people with BPD can still be successful. It drives me insane. I've done videos about that before. Like The Sins of My Colleagues, I think was the series that I did. So again, Taylor, I don't know if you have it or not. I haven't evaluated you. But what I will tell you, go online, get the DSM-5 criteria for BPD, take them into your session. First of all, make notes on them. Like, if you think you have the criteria, circle the ones you think and write down examples in the margins. Then take those in and ask your therapist to walk through the criteria with you and decide together. Like, this is your brain and your body, and you get to decide. You should have a say in the diagnosis, I should say. So I'm sorry that that's happening. Don't give up, though. And if you really think that it helps, what's important is that you get the accurate diagnosis so you can get the best treatment. So print out those criteria and take those in. I feel like I have a lot of the symptoms, but apparently not enough to be diagnosed. You need 5 of the 9. So there are 9 choices, 9 opportunities. And if you have 5 of those, then that warrants the diagnosis of BPD. So print out those criteria and see for yourself what you think. Okay, I'm showing 15 new messages, so bear with me. Okay, so once I scroll down, then it like populates them all and I have to go all the way back up. Is that link also for people from the UK? I'm from Scotland. Welcome. Yes, it is. It's the psychoeducationacademy.com is my online training platform. And then you just the link is in my bio actually, but you will, to get the Cyber Monday offer, you will have to type in a / after the .com and then CM-NATS. So that should work for you, RY official. If it doesn't, please message me. Okay, diagnosed BPD and NPD. So, Chris, that's a challenging combination. You're up against some, particular challenges there. Don't give up. Don't be dismayed. I've been treating personality disorders for over 20 years. You can get better, and you will get better if you find the right therapist with the right treatment and you actually do the work. Just don't give up. Be willing to have the insight. Be willing to introspect. Your therapist doesn't know everything, but be willing to consider the ideas that they give to you and the suggestions that they make and see where you might be the common denominator in some of the issues that you're having. So keep fighting. Yes, RY official makes a good point. Lots of very successful people in history who very likely had or have BPD. Absolutely. You can see a lot of that from their behavior. Yes, there's another list. Thank you for sharing that. Because you can absolutely be successful. Diagnosed with BPD after I had a miscarriage in June. It's an interesting time for a diagnosis. I'm not sure what led to that, but certainly say more about that if you're willing. So PTSD has a lot of overlap with BPD. So PTSD very commonly is part of BPD. She said, I have complex PTSD, so I don't know. It's very confusing because I relate so much to BPD. You can have PTSD and BPD. And again, this isn't about pigeonholing people or fitting you into some neat little box. This is about making sure that you get the most accurate diagnosis so that you can get the best treatment. So for those of you who aren't familiar, PTSD versus CPTSD. PTSD is post-traumatic stress disorder. CPTSD is complex PTSD. And personally, I don't really like the distinction. I think it just makes things confusing, and I think it minimizes the whole definition of PTSD. Because you can have PTSD from witnessing or being part of one traumatic event or a host of traumatic events. Now, the argument, I think, behind people who make that distinction, it's not part of the DSM, maybe it will be in the future, but I think the argument behind making that distinction is for people to understand that there's PTSD related to one thing, and then there's PTSD that's related to multiple events. And so to me, whatever the case, it's post-traumatic stress disorder, and we need to do prolonged exposure to treat that. And then possibly some medications to help with some of the symptoms if needed. So PTSD and BPD can coexist. I would argue that they most often do coexist. And that's because of what I said earlier, that most people with BPD have endured some trauma. There are other causes of BPD that I've talked about on my TikTok, but most often there is some sort of trauma. So PTSD is most often a part of that as well. Okay. Okay, will do. My girlfriend has helped me become kind of self-aware. It's awesome, Chris, that you're open to that. That is great. Yeah, that's very good for your prognosis, the fact that you're open to that and you're willing to become self-aware. Okay, Emily, circling back, in the mental hospital when I found out I was pregnant 2 days after. Okay. Discharged. I had a miscarriage. Then 2 weeks after that, I was diagnosed because of self-harm and suicidal ideation. Okay. I haven't evaluated you, but I'm just thinking like, it could be that this was just the precipitating event that finally, moved into the manifestation of enough symptoms that somebody's like, hey, I think this might be going on for her. It could be that you were just terribly, horribly depressed, which is common after miscarriage, and you just resorted to those sort of coping skills briefly. So it depends on your history, but sometimes there is that precipitating event that finally moves someone over the edge of like really endorsing or really demonstrating the BPD symptoms. So it makes sense. Thank you for elaborating. Casey, diagnosed with cyclothymia, but I relate to BPD. Yeah, I've done videos on the different types of bipolar disorder and mood disorders and stuff like that. And a lot of people are diagnosed with something else, cyclothymia or rapid cycling, bipolar disorder, and it's really a borderline personality disorder condition, or maybe both. I think, to me, what's important is that you have a thorough clinical intake interview with a licensed psychologist who's versed in personality disorders, so that you can understand, so that they can understand like how this all came to be, where this comes from, stuff like that, and help you really get to the bottom of the diagnosis. My dog just hopped down. You guys may or may not be familiar with my little Opal. She just hopped down, which probably means she needs to go to the bathroom. So I'm going to have to wrap this up. But let's see, I've got some, let me try to respond to these. Okay. Taylor, do you do one-time evaluations? I do, but it's not a one session kind of thing. My intakes span several sessions because I look at all your patterns and current functioning, and then I do a deep dive into family of origin and history. So to help someone discern a diagnosis, yes, I will do that evaluation. Just be advised that it's not just one session. Doing inner child work now with my therapist, significant amount of trauma. Good. I'm glad to hear that you're doing that work. BPD is like a paper teller, schizophrenia, OCD. I'm sorry, I'm not tracking that one, sorry. I think maybe you're saying there's like coexistence of a lot of these conditions sometimes. Okay. These are all Venn diagram with BPD. It's sort of nitpick at them. Okay. Oh, with that there can be overlap. I got you. Okay. Sorry. I gotta go back. Bear with me. Childhood trauma. Yes, childhood trauma can cause BPD. I'm not sure if I'm missing something there. What state am I in? I'm in Arizona, but I can see people in most of the United States. through a reciprocal agreement called Psy.Pact, Psy.Pact. You can go to psypact.org and see if I can practice in your state, or just shoot me a message and I'll talk you through that. Mine is a specialist in bipolar, so I'm concerned she's biased, but I haven't asked her about BPD. So, okay, see, so yeah, take the BPD criteria in there and just ask her to walk through them with you, and see if, just see if you can get to the bottom of what's really going on. Major anxiety, major depression. Yeah, real dad left me at 4 months old to have abandonment issues. What can I do to help myself? Confidence. We are working on a lot of those issues in the subscription group, so I would invite you to join that. It's $19.99 a month. It's free for the first 7 days. You can see if that works for you. And I'll be taking suggestions from the members of the group and doing videos and content around that. So helping self-confidence, ultimately you have to get over those underlying self-limiting beliefs that were developed when you were little based on some of the experiences that you're talking about. So you have to work through those. I have a course called the Belief Reset on the Psychoeducation Academy as well. That's a great place to start if you don't want to do therapy or can't afford therapy or just aren't sure where to get started. It's called the Belief Reset at the psychoeducationacademy.com, and that link is in my bio. TikTok only allows so many characters for a message. Yeah, no problem. Okay. I believe I have gotten... Oh, I'm seeing a few more messages, and then I'm going to wrap it up. Opal's getting restless. If there isn't any help in my city, should I try a Buddhist monastery? I'm not sure. I don't know a whole lot about Buddhism. I know they do teach a lot of mindfulness and self-awareness and stuff like that, so I think it could be helpful from that angle. Is BPD from childhood trauma? Yes, Gina, that's one source of BPD. I've done videos on the other causes of BPD, like brain anomalies and neurotransmitter issues and stuff like that, so you can check those out in my feed. I want to join. Emily, we'd love to have you. Like I said, it's free for the first 7 days. And then $19.99 a month after that. You can cancel anytime the content's not useful to you. I want it to be helpful. Diagnosed BPD in Mexico, but not here in the US, but psychiatrists thought it was autism. Yeah, so a good clinical interview will help you sort out the diagnosis and kind of get to the bottom of that. Hey, Cody. All right. Appreciate your time. Thank you. It's my pleasure. I enjoy doing these. Just wanted to hop on briefly and talk about some of the ways to overcome BPD. So I will be back. I'd love to see you guys in the subscription group, free for 7 days. So come check it out. Set a timer in your phone so that you can go back and reevaluate if the content's been useful for you. Mom is bipolar, schizophrenic, meds don't seem to help. Any suggestions? I would say a good, thorough clinical interview by a psychologist is the first step, because we need to make sure we have the right diagnosis. And then, then also get a prescriber who's versed in those conditions and can kind of help sort that out and see. But the diagnosis is the most important part, and psychologists are generally more well-versed in that because we spend more time with patients than psychiatrists or prescribers. That's just the nature of the practice, says nothing of them. The sessions be with you. If you do individual sessions with me, yes, that's with me. If you're in the group, yes, I'm the one who's running the group, and I'll be doing the content and the lives. So yes, I think on both counts. All right, guys, I am gonna head out and take my little girl out before she pees in my office. I will see you guys soon.